Local stories, local people. We're taking you inside Western Mass news. It's the Even Better Western Mass podcast with Dave Madsen.
Good to have you with us for this week's edition of Even Better Western Mass as we head 3 weeks into the coronavirus crisis here in Western Massachusetts, across the country, and really across the world, wherever you are. I do hope that you're doing very well. To say the least, this has not been easy for any of us, but we're all getting through it in some way, shape, or form. You know, I think if nothing else, it's given us a greater appreciation of what we had before all of this started a few weeks ago. You know, each and every day we hear stories of people going above and beyond to help others, not only for those on the front lines, but people making handmade masks, bringing meals to first responders. Well, we're going to start today with a Holyoke company, Universal Plastics, that's shifted their production to make medical face shields and intubation boxes to protect doctors and nurses treating COVID-19 patients. I spoke with the Chief Strategy Officer, Pia Serene Kumar, over Zoom about exactly what they're doing. Now, do you normally make the medical face shields and intubation boxes, or are you doing it just for this purpose?
No, it's just for this purpose. And I have to give a huge shout out to our engineers, because normally we have like a 4 to 6 week process, because we design all of our things from scratch and we do CAD drawings and then we build the fixtures and the prototypes, and there's a long process, and they turn this stuff around within a week. We do a lot of medical work, so we do have experience with medical work, but we typically work in engineered resins that are a lot thicker, so very rigid plastics. So we do a lot of stuff like covers for MRI machines and lab diagnostic machines and special medical trays that are chemically resistant. We make sharps containers where they dispose of injections and needles and things like that. They have one in every doctor's office. So we definitely have some medical experience, but typically we don't make things like shields because they're very much thinner plastic. And you know, the other thing that we're making, which is really kind of neat, is the intubation box. And both were in direct response to the need that's come up now with the COVID crisis.
Now, what does it take to gear up the production line to be able to do something like this?
So we have to source the material, which, believe it or not, these days is becoming very difficult. You know, I think there's a little bit of hoarding happening when it comes to plastic material, just like it's happening with some of the household products. And typically there's a lead time because we work with a lot of, as I said, specific engineered resins. So it takes a few weeks to get the material in-house. And then after the engineers have come up with a design that they feel is manufacturable, then it gets sent to the tool room. And the tool room is really a place where a lot of magic happens. We do all of our tooling in-house. And so tooling is basically, think of it as all the stuff that you need outside of the actual machine to get the product manufactured. So they have special fixtures that hold it in place and different setups that make it ergonomically viable for people to assemble them, because all of our work tends to be very labor intensive, including the face masks. So it gets sent to the tooling department, and the tooling department works on the first few pieces to get all the kinks out of the manufacturing process and to make all the fixtures and the other things like I was saying. And then after that, it goes out into production. And then typically, depending on how many of something we're going to produce, we either dedicate what's called a manufacturing cell that makes just that. And so that's typically for higher volume things. The shield is one of those. We're making 1,000 a day. And we have a cell that's set up of 2 people that are die cutting the material into the shape that's needed. And then after that, they're assembling the cord, the bungee cord that goes on the back, along with the little clip that makes it adjustable. So we set up either a cell type manufacturing process, or we just have a person with a machine that's manufacturing it and then doing all the assembly and then packing it. This is what it looks like. And this is
very simple, but very complex.
Yeah, exactly. So this is the piece that I was saying that keeps it clogging.
Yeah.
And this is the bungee cord in the back that's adjustable. So here's where you have to loop it in.
Okay.
And this is what makes it adjustable. And this is actually a very labor intensive, this whole part. Because if you think about it, you have to loop each one in, knot it, and then there's another piece inside this black one that makes it, there's a little clip where you can,
yeah. Oh, yeah. I see. Yeah.
So it's kind of like its own little mechanism. And, we can make 60,000 of these, but we're limited by the components because it's hard to get these grommets. It's hard to get these bungee cords, these clips. Supply chains are just getting more and more backed up these days.
Sure. Basically, I need them yesterday, right?
Exactly. So I'll put it on.
I like it. So it fits very tight.
Yeah, fits very tight. And it covers your entire face and beyond. So gets the job done.
It sure does.
And you just wipe it down with sanitizing wipes, and you can reuse it. It's durable. It's not going to snap on you. Obviously, there's a lot of need in the community, and the response has been great. People are really excited. We want to take care, as I said in my email to you, we want to take care of our Western Mass family first. So we're reaching out to hospitals, nursing homes. They're reaching out to us. The first people to get them, though, were our employees, because we want to keep our employees safe. We're doing a lot in the plant to stay open, to keep people safe. So all of our employees got one, and if anybody that our employee has in their family that is in the healthcare field, they got one as well. And, we're working with the city of Holyoke, all of the local hospitals, but there's interest from hospitals all over the country. So what we're doing is, first helping the communities that we work in. We have a facility in Holyoke, and then we have 4 others as well in the Northeast and the Midwest. So those communities are going to get them where we live and work, and then we're going to send them to the rest of the country as well. The other thing that I've been hearing a lot is that, nursing homes and places where aides work and nurses work that aren't necessarily hospitals are really struggling, because a lot of, there's a shortage, and the hospitals with the really sick patients are getting prioritized. So we're making an effort to really reach out and get some of those needs met as well.
This is really a time. When you talk about a company like yours really shifting production to help out in this, it's almost like a wartime situation.
Yeah, feels that way. It sure does.
It is a war. Now, let's talk about the intubation boxes too, because those are just as important as those masks.
Yeah. So the intubation box is really neat. And our engineers came up with this really ingenious design. And what's so cool about these boxes is that they make it really quick and efficient to intubate a person. So normally what happens is if a patient is exhibiting symptoms, the anesthesiologist comes in, they have to interview them for 10 or 15 minutes, ask them questions. In the meantime, they have to put on gowns and masks and all this protective equipment, because the risk is that when you intubate a patient, they spit up and they tend to, have fluid come out that then makes the provider could get them infected. With this box, you just take it and you mount it right on top of their upper half of the person. So there's no sort of time frame needed. You can talk to them, you can interview them while the box is placed over them, and then there's 2 holes where the provider could stick their hands in and intubate them if needed. It's reusable, so you could use it over and over. We make it out of a very nice, again, medical grade, rigid plastic material, and we use a medical grade adhesive to glue the pieces together. So it's easy to sanitize and easy to clean, and you just mount it on top of the ICU bed or the hospital bed. By the way, we make hospital beds as well, so we know how those work, and then you're good to go. This was, I have to be clear, this was an innovation by a doctor in Taiwan. He came up with this idea in response to COVID-19. So again, this is all new. This is all stuff that's really come up in the last few months, which is, a very nice positive outcome of a lot of negative things that have happened. But he came up with this idea, and it's been embraced sort of by little pockets of people across the medical community. And we're working with a few anesthesiologists in particular who reached out to us and said, can you do this? And I know they're testing it at Bay State. We're working with some hospitals, one in Miami, to make sure we're getting the design right and sending this stuff to them. And we're starting production on it next week.
That's amazing. I mean, when you were looking at the business plan for the coming year, this has got to be the last thing you folks are thinking about.
Yeah. Well, our business is actually primarily aerospace and airline interiors, and then also medical. Those are kind of the two big things that we play in. As you can imagine, the airline interiors and aerospace market is definitely slowing down right now. And the medical market continues strong. The reason we've been designated essential and we are continuing operations is because we have a lot of medical customers, and we are making parts for machines that are directly helping fight COVID. As I said, we have a lot of lab diagnostic machines. We make panels for the Sharps containers. So we have letter upon letter from customers saying, we are essential. You are our sole supplier, so you need to be designated essential. And so, we're really trying to embrace that work, support those customers. People are scared, even though we're taking all the precautions that we possibly can at the factory. We are seeing some absenteeism. And between the reduced workforce and the reduced amount of work we have, we're just trying to optimize getting the most essential medical work done, and then manufacturing this PP&E to help our community and the other healthcare workers.
Now, I've talked to some smaller businesses, say in East Hampton, the impact on them. What's the impact overall been on you? I know like you said, some people staying out and everything else, because this is so unknown.
Yeah.
I mean, there's so many unknowns that go along with this. It's got to be tough for any business to try to find the best thing to do, not only for themselves, but for their employees.
Yeah. Well, for us, it starts with our employees. If you look on our website, we only have two corporate values. One is that we are a family company and our employees are part of that family. And two is that we exist in service of our customers. So we don't have a long list of values and a lot of different adjectives. For us, it's very, very simply and personally about our employees and our customers. And so we have, I think the impact on us, and it's a really thoughtful question for you to ask. We're making sure we're trying to keep everybody safe, but the operational impact of researching new procedures, figuring out what the best way to do things is, rolling it out, something as simple as, how to put on a pair of gloves. There's the right way to do it that makes sure that you stay hygienic, and then there's a wrong way to do it. And it's a really simple thing. It shouldn't even, you wouldn't even think that there would be a way to do that. But if you really sat down and looked at it, there's a procedure for that. And we have a procedure that we are teaching people and training people on how to do it. So if you think about that, it's researching the procedure, it's documenting it, it's putting it up and sharing it in a way that's visual and quick for people to access. And then it's training them. And then it's making sure that they're doing it and, answering questions and enforcing it. And we're doing that for everything from how you wear gloves to, social distancing. We staggered our lunch breaks so that people aren't eating lunch at the same time. We're handing out face shields. We are just constantly adding new things that we're doing. And something as little as having a new bulletin board up that has all the latest information on what we're doing for this crisis. Think about that. Somebody has to go order the bulletin board and it's back ordered because all the supply chains are choked up. Then you have to put it up. You have to write the memos. You have to make it really visual so that people aren't, they're not going to sit and read something that has, all these tiny words on it necessarily in the middle of their busy day. And then you have to enforce it. So I think that's been the biggest challenge. We're a small business. We're family owned. My husband and I both work in the business. We have a lot of longtime employees and we have a great workforce. And we're trying our best to do right by our customers to keep our employees safe. And it's just hard because things are changing really fast. And I didn't even get into all the legislative changes that, I probably don't have to tell you about. I'm sure you're aware of them as far as employers go, as far as employees go. There's legislation out, but the forms aren't out. So
Sure.
I think that's probably been the thing that's been the hardest, is the amount of work it feels like to just get it right and do the right thing.
Yeah.
Not even look to make a profit, not even look to grow your business. Those aren't even things that are on the radar anymore.
Now, if anybody listening to this or hearing this or seeing it, if they are interested in either one of these products or both, what do they have to do?
They could go to our website. We have some information about it. They could call our main line. That number is 413-592-4791. And at extension 123 is Jim Roper, my sales manager. He'd be happy to help them out. Again, that's 413-592-4791, extension 123.
And your website is?
www.universalplastics.com.
Well, there's a reason you've been in business for a long time, and it's taking care of the community, and that you have so many people who've worked for you for a long time is taking care of them. It's a credit to you folks for doing that. And this is something else. I mean, I don't think this is something we will ever experience. Let's hope we don't have to experience anything like this again.
Yeah, exactly. One and done. Thank you very much.
But I think in hindsight, as you look at it now, it's like, hopefully we all come out of this a lot stronger.
Yeah, I definitely see that. And I think, that's something I feel very strongly about the Western Mass community. I didn't grow up here. I didn't have the privilege of growing up here, but we moved here 7 years ago when we bought the business. And what I love about this place is that people really band together when the going gets tough. We all get tough. We all do it together. I mean, coming back to the face shields, we have people in our front office that don't have any manufacturing experience, that are sitting and threading the loopholes in the back to get these out to the nursing homes and the healthcare providers that really need them. And that's something I love about our community, that people just do what's right and they do what it takes. And I totally agree with you. I think we're going to come out of this stronger and better, and hopefully healthier as well.
Pia, thank you. And thank you for what you do, and this day and every day.
Thank you, Dave.
More and more of us, as you can see, are working from home, as I do Even Better Western Mass. But over the course of the last 3 weeks, I've been doing afternoon updates as far as what's going on with the COVID-19 crisis here in Western Massachusetts from the living room of our house here. Many of our reporters and anchors also working from their homes, too. It is, I think I've said this before, it is our new normal, at least for now, finding different ways of being able to bring you the news each and every day. Yesterday, I had a chance to sit down here by myself, but through Zoom, with a number of our reporters and anchors and meteorologists about how they're faring through all this and how this has kind of changed them. Today, so we're 3 weeks into this. How you all doing?
We're doing all right. I've been at home almost the entire time, working from home, that is, and it's been quite the journey so far.
Not what we expected, is it?
Not at all.
How about the rest of you?
So it's been, for me, not that I'm an anxious person by any means, but it's really progressively gotten more serious in my mind. Only because I'm not only thinking of myself, but I've got to keep my kids safe. I've got to keep my wife safe. And this one is hitting a little different. It's hitting a little closer to home for whatever reason. So it's been, I know that, we work 5 days a week, and then we try
That's a fun part of working at home.
I know, right?
That's not a dog. That's somebody who works at the station.
Yeah, that's good, right?
Poor Brittany.
Audrey, how are you doing? I mean, you really haven't been working at home. You've been out on the road, but have not been going to the station. How's it been for you?
Yeah, it's actually really interesting because, every day I pack up and I leave my house, and I literally do think of it as going from a place that's, comparatively safe, like it's healthy. Nobody in my, very small, albeit family, has it, but kind of going out into the world where it's a lot more unknown. Granted, I've been fortunate enough to be able to do a lot of phone and FaceTime interviews and stuff, but There are things that you miss. I miss typing on a keyboard. I've been typing all my stories out on my cell phone, which isn't always easy. I miss having a lot easier access to a bathroom. And I miss being able to, go out, and if we want to stop and get lunch somewhere, being able to kind of sit and eat it and enjoy the surroundings. Like, it's a lot of just sitting in a car, and making sure that you're calling and getting everything done. And it is funny because I know a lot of people who are working from home, their workload is a little bit different. Maybe it's even lessened, or it's changed a little bit, or their routine has changed. I feel like my workload has only gotten heavier since all of this started. And it's a responsibility that I appreciate. And I appreciate being able to bring information to people, but it's been a lot. It's been challenging. It has.
Yeah. Jana, what working from home, some of the challenges in working remotely too, because I know all of you in the weather department, you're all working separate shifts and you don't touch base with each other.
Yeah, I mean, Jacob and I will actually see each other in passing as he's leaving and I'm coming in, but I mean, it's actually kind of fun working from home a little bit. I'm like the only one who enjoys it. I got, my nice little setup. I come in, it's quiet. I do my forecasting, which you can do from anywhere. And then I save the computer work for being in the building and going on air. The hardest part, I think, is just the disruption of my routine.
Yeah.
Doing all kinds of stuff during the day, going out, working out at the gym, and now it's just here in the office. But I'm blessed to be able to go to the office. Even though there's not many people there, at least it's a change of scenery, which is nice.
Beth has joined us. Beth, you started working from home this week.
Yeah, that's it's been, sorry, I'm late. I'm craziness, which is every day has been crazy. But we're taking turns working from home. They're only allowing one anchor in the studio, which is great. My setup here, let's see. David, similar. Brittany, I know you have a similar one.
Yep.
But it's the technical challenges aside, we're figuring it out, right?
The lighting is good, though. The lighting looks good. I mean, it's, I go back to television days where we did film. So the whole idea that I'm sitting in my living room and I'm doing stuff live through my phone still is mind-blowing for me.
Oh, my gosh. No. It is for me, too.
Do this thing.
Yeah, so it's interesting. I'm actually waking up the same time, but working an hour earlier because I have to memorize a lot of scripts. Being on camera without a teleprompter, you don't realize how much you actually have to memorize throughout the day. So my workload is changing. It's changed because of that. I'm not going out and doing stories. I'm helping to set up here and there, helping to write scripts here and there, but it's more so memorizing. And let me tell you, the biggest thing, technical issues, of course. My Wi-Fi drops every now and then. You'll see me just turn gray on TV, and then I have to run over and reset in between reads and in between breaks all the time. But we're working on that. We're working through it, and it's something that I can keep an eye on now. I know to watch out for. But the biggest thing is like the camaraderie. Like, I don't have any social interaction except for my baby or my mom when she has a chance to come over and babysit for the 4 hours that I'm on TV. And
I was wondering how you did that. I was wondering who's with the baby.
Yeah, so when my fiance is not here, my mom comes over and will watch the baby. But now we have to deal with my fiance being a first responder and them being exposed and us going into the peak of exposure and more people, more cases coming up. So it's turning into being a single mom while also working at home because we need to distance ourselves that much more. So that's a whole new issue that's coming about with this. But I am lucky and thankful that I can work from home and I have these resources that we're able to still have that option that I can keep the baby with me. So
That is one of the challenges, I think, in all of this. I mean, we haven't seen our grandkids now in 2 weeks. We don't want to take any chances with them. Do you find yourselves in all of this? I mean, it's like, yes, we're out in front of things and on TV, but it's like there's the personal aspect of this thing too.
And I find it so frightening because, like I said, I can stay at home and I'm distancing myself in that way, and I'm lucky, but my partner's still going out, and if anything, he's facing it more than I ever even would if I didn't have to work from home. So it's definitely a threat, and it's something we're staying on top of, temperatures, testing temperatures every day, and a lot of separation now.
Jana and Jacob, is it pretty much work to home and very few stops, if any stops in between?
For the most part, for me, yes. Although we are starting this moment of zen to end the 6 o'clock newscast.
Did you ask Jon Stewart about that?
Been
copyrighted.
By the way, I love that, Jacob. I love your moment.
So interestingly enough, they have not copyrighted, so we're using it.
Look at
yes,
that.
we dug into that and made sure we dug deeper to make sure that it wasn't copyrighted. But yes, so for me, I'm still out a little bit. Like the other day, I was at Mitney Park in West Springfield. I'm practicing that safe physical distancing, and I'm in my car, then I'm putting the drone up, and then I'm back in my car. So I still feel like I'm being safe.
Yeah. Jana, how about you?
Yeah, it's basically from here to work and back. My husband isn't, his shop is here pretty much all the time now. And I mean, I go out to the grocery store on occasion, and that's really it as far as social interaction. And even going into the grocery store, it's usually full of people. So I'm always like stressed. Everybody's just touching everything, and I'm like, oh my God, I'm going to end up getting it and giving it to my work. And so it's super stressful. It makes me not want to really go anywhere.
I do think, and I've talked to a few people about this, the fact that the weather has been fairly decent except for rain and that snow last week. If we had been sitting in snow and stuff over the last 6 weeks, this probably would have been not very good for all of us. At least we can get outside.
Yeah, we're lucky we have the dogs. So we take them every day for like an hour. It's just nice. For an hour.
They're exhausted. I went out this morning in the rain, and there were so many people out walking even in the rain this morning and in my neighborhood. But I mean, all, keeping a distance, but waving from afar, which is kind of nice to have that contact a little bit. I mean, literally, I don't know about you guys, but and I know, Jana, you've been doing this, you said, we're walking, or me, or some combination of our little family who's here and the dogs are walking 3 times a day, early in the morning. And then, when I get off the news, and then again, before we go to sleep. So in that respect, it's kind of nice to see somebody.
Yeah. A human.
Absolutely.
Yeah.
I miss seeing our other coworkers. Like, I miss having our morning meetings where we can all kind of like go in and joke and like ask each other about our lives a little bit. Like, it's, there are people who have kids and you hear about what their kids are up to, or there are people who are, trying a new hobby or something like that, and you get to hear about it when you're in person. And then like when you're separated, like you don't get to like, those are the things that make work nice. Those are the things that make work fun, is whenever you get the chance to kind of catch up with each other, like as people. True. And so it's a little bit tough just to like not have that, because it's sad, not feeling like you're a part of the sort of group dynamic that you normally are. One thing that I will say that's awesome are seeing all the creative ways that people are trying to bring their communities together, like the Agawam teddy bear hunt that people are doing. Just like ways to set up, and I think there are some lessons, as horrible as this is scary and upsetting as it is. There are some lessons that I think people are learning about just like community connectivity and like enjoying each other's presence, even when you're physically separated, that I hope that, maybe we'll be able to carry through after this is all over. And maybe we'll all feel a little bit more unified.
Yeah, I think that's true. That part of what we do is like day in and day out. We get up, we go to our jobs, and we come home and we have dinner, and we go to bed or whatever else. That this is kind of putting people in touch with their neighborhoods and the people around them. I know a lot of people have been, they haven't seen their neighbors in a while, and they've been contacting each other. Listen, if you need anything, Beth, you've been out on the road doing stories too. Any stories that stand out? The things that people are doing that really have touched you?
Yes, actually, I've had, I don't know about you guys, but I've had, and Dave, we've talked about this, but I have had a couple of moments where it just, because we're living, breathing, sleeping, eating this, and I've had some like, oh my gosh, moments where it's scary and it's depressing and overwhelming. And then like Monday, so I've been trying to do more of the positive stories, like Mr. Rogers says, find the helpers. Mm-hmm. So I found this Longmeadow letter carrier who has been doing this for 34 years. And he always, I've known him and seen him in the community forever. I'm just over in East Longmeadow, but I, just getting coffee over there. But he always has a smile on his face. And I ran into him literally doing another story. And I said, hey, can I just interview you? And we ended up interviewing him. And then we followed him around his route. People are waving to him because they know him forever. And it just warmed my heart. I got so much response from that one story. And I was very proud that it was like the most viewed one for that day. Because, we all have that little competition going on. But, that just warmed my heart. It just made me realize that people are hungry for that type of thing.
Yeah, I think they are. Actually, I've got to wrap this up. As we do that, I want to go around the horn with all of you and to tell me if this has changed you, how it's changed you, and do you think what we're going through now and is going to change or has changed the approach that you take to your job each and every day?
It's a really good question. I think it's changed the way that we communicate. Absolutely. I know for me, even in personal relationships, I'm communicating a lot more because we have to do it in a different way. It's not like, oh, we'll talk about that when we see each other. It's like, we're not going to see each other until we don't know at this point. So you have to have those conversations. And as Beth had mentioned, it's nice that people are reaching out in different ways to communicate and keep that community together. And I think that will hopefully change the way that we go about things in general in the future and appreciate what we have.
Sure. Audrey, how about you?
Just a second, what Brittany said about appreciating what we have. I did a story on how this whole situation with public buildings being closed down, how it's affecting the homeless population, and realizing how this is affecting and making the problems that they already face on a day-to-day basis worse. I think it's going to change my approach going forward whenever we hear about a story where people are struggling with access to certain basic necessities. I'm going to think about that time when, hey, remember when all of those things were closed down? How can we help maybe expand this or, figure out ways to bring these stories to light in the future so that we can kind of help people. It makes you realize what you have and it makes you grateful for what you have, but it also changes your mindset going forward as to what lens you look through these sort of community issues with.
Jenna, how about you?
I mean, my day-to-day job probably won't change much. I'm not as immersed in the story as everybody else. But naturally, I'm kind of a recluse anyway. And so when I'm, at work, I'm usually by myself. And but now this total isolation is, I don't know, it's making me kind of think differently about it. And maybe going forward, I don't know, you take things for granted, the people around you all the time. And now that I can't have people around me all the time, it makes me kind of crave it. So I think going forward, just, I don't know, changing my outlook on life a little bit. It's hard not to let it change everything because it's so dramatic, and not really going to change the way I do my job, but just the way I am with the people at my job, I guess.
Yeah. Jacob, how about you?
So I think that, to Jana's point, I don't think my day-to-day job is going to change all that much, but it's hard to believe that we are living history the way that we are right now, where we're looking back 102 years ago at the 1918 Spanish flu. We're now living this time that in 100 years, they're going to say, remember March 2020 and the COVID-19 outbreak, And so we're living this time, and I think society is changing. I don't know what that means. Are we going to go to a no handshake society just to prevent these things moving forward? I think broadcast industry is also changing, where we don't maybe need these fancy setups as much, or maybe we're going to be more inclined to go to these at-home setups. Maybe even as a part of your job application, it's going to be, hey, do you have an in-home studio in the event of something happening? So I just think.
Well, I just want to, it makes me really, so it makes me feel grateful for the relationships that I have at my work family and otherwise. And I know this sounds really, I don't know what the word is, but so cheesy, I guess, but I miss everybody. And I think what Jana said about, and what I think everybody is saying here, that moving forward, I really hope that this gives me a greater appreciation again for all you guys. And I love you guys. And I miss you all so much. And I miss connection. I so miss connection. You all know I'm a hugger, and I'm craving that. I'm just
no
craving
more, Beth.
We've heard so many things about the good things being done, but every now and then you hear the story about someone trying to slip one through or do something stupid even after they've been told not to. This week I heard the story of 3 golfers from Massachusetts who decided they were going to go golfing in Rhode Island. Courses in Massachusetts are closed. They are opened in Rhode Island, but the thing is in Rhode Island is state officials there have said that if you are coming in from out of state and you're going there for purposes other than business, you have to self-quarantine for 2 weeks before you do it. Well, apparently what these golfers did was they parked their cars with the Massachusetts plates in a McDonald's parking lot, then moved over to a car with Rhode Island plates, which apparently they rented. I'm not exactly sure. They borrowed from somebody, then went off to play golf. Well, about 2 or 3 hours later, after they were done, they came back to their cars with the Massachusetts plates, and there were police waiting for them. They were arrested. And this is a misdemeanor, is what it is in Rhode Island. They could be fined up to $500, or they could go to jail for 90 days. It'll be interesting to see how this plays out. They have a court date, I think, sometime in May. Hope it was worth the price of playing golf. But, the restrictions are put in place for a reason. What we have to do now is listen to the specialists who are saying stay home. That's the best way to stay safe. We'll get through this, and we'll get through it together. It'll be over soon. I'm Dave Madsen. Thank you for watching and listening to this edition of Even Better Western Mass. Stay well.